Welcome back to Gray Matters, the podcast where we break down neurological disorders in clear, caregiver-friendly language and explore how communication and speech-language therapy can change lives. I'm your host, Graycee West, and today we're talking about Parkinson's disease. To help us walk through what this looks like in everyday life, we'll be joined by Mr. Holden Harris, who's going to tell you a little bit about his experience living with Parkinson's disease. Let's get started. Parkinson's disease is a neurodegenerative disorder, meaning that over time, certain brain cells break down and stop working properly. Most people know Parkinson's for its effects on movement, balance, and muscle control. But caregivers are often surprised to learn that Parkinson's can affect so much more than movement: speech, swallowing, thinking skills, and even facial expression. A key early sign? Many people start speaking more quietly or develop a masked facial expression long before the tremor appears.
My wife says I don't smile as much anymore, and people tell me I talk too softly. But to me, it sounds totally normal.
This kind of experience is extremely common. People with Parkinson's often lose awareness of their own volume, so a normal speaking voice feels like shouting. Facial muscles may also move less automatically, making expression look flat, even when emotions are normal. So, what's happening inside the brain? Let's simplify it. Deep in the brain is an area called the substantia nigra, which helps your body start and control smooth movements. The cells there produce a chemical messenger called dopamine, which acts kind of like the brain's movement coordinator. In Parkinson's disease, these dopamine-producing cells begin to die. We don't know exactly why. Research suggests a mix of aging, genetics, and environmental factors like exposure to toxins or previous head injuries. Once the brain has lost about 80% of its dopamine, the classic symptoms begin to appear: tremor, stiffness, slowed movement, balance problems, speech and swallowing changes. Parkinson's is progressive, which means the symptoms continue to evolve over time. Caregivers may often hear their loved one described as being in stage 1 or stage 3. So here's what this actually means in everyday terms. Stage 1 is mild symptoms, mostly on one side. So daily life feels normal, but you might see a tremor in one hand, a change in posture, or a slight difference in facial expression. Stage 2, symptoms are seen on both sides. Daily tasks take longer, walking gets a bit harder, and posture changes become more noticeable. Stage 3, balance problems appear. Falls become more common. Independence is still possible, but daily routines take planning and patience. In stage 4, there's a severe disability. Walking is still possible, but it often requires support, like a cane or walker. Most people need help with daily activities. And in stage 5, this is the most advanced stage. A person may be unable to stand or walk independently and needs 24-hour support.
It's the little things, like buttoning my shirt or handwriting. I used to sign my name in one quick motion, and now it feels like my hand won't keep up with what my brain wants.
Parkinson's affects both fine motor skills like writing, eating, or fastening clothes, and larger movements like walking or getting up from a chair. Some people also develop changes in memory, attention, or planning, especially later in the disease. Let's connect this back to the neuroanatomy in simple terms. Movement is controlled by a group of structures called the basal ganglia. Think of them as your brain's movement quality control team. They help movement start smoothly, stay steady, and stop at the right time. The basal ganglia rely heavily on dopamine from the substantia nigra. Without enough dopamine, movements become slow, muscles become stiff, and resting tremors can appear because the system is out of balance. This same system also affects speech muscles, swallowing muscles, and even the automatic blinking that keeps eyes moist. As an SLP, some of the first changes we notice in Parkinson's include reduced vocal loudness, people speak softly and may become monotone, slurred or mumbled speech, muscles move more slowly, mask like facial expression, not because emotion is gone, but because the muscles don't move automatically, swallowing difficulties, coughing, choking, or clearing the throat during meals, and cognitive changes. Some people develop memory or attention challenges, and a smaller percentage develop Parkinsonian dementia.
People ask me to repeat myself. A lot. I try, but sometimes the words just don't come out the way they used to.
This can be incredibly frustrating for both the individual and their caregivers, but there are strategies that help. Speech therapy plays a major role in Parkinson's care. Here are some strategies we often teach. Number 1, increasing vocal loudness. Because self awareness of volume decreases, we often help clients practice speaking louder than what feels normal. We might use a sound level meter or simple smartphone apps to give real time feedback. You can try at home, asking the client to imagine they're speaking across the room, encourage short, clear phrases, and reduce background noise during conversations. We also focus on improving speech clarity. We might practice exaggerating mouth movements, slowing the rate of speech, taking deliberate breaths between phrases. This helps reduce mumbling and makes words easier to understand. Another big part of an SLP's job is to support swallowing and mealtime safety. We help clients practice coordinated swallowing to avoid coughing or choking. Caregivers can help by encouraging small bites and sips, making sure the person is fully alert during meals, and minimizing distractions during mealtime. One final service that SLPs may supply to Parkinson's patients is cognitive support. If memory or attention are affected, SLPs can help with daily routines, creating planners and phone reminders, simplifying tasks, and reducing clutter and noise at home. These supports make communication easier too. Before we wrap up, I also want to talk directly to the caregivers who might be listening. Parkinson's can change the rhythm of daily life, not just for the person living it, but for the entire family. Here are a few simple, practical things that can make everyday communication a little easier. First, build in extra time for conversations. People with Parkinson's may need a little extra moment to start speaking or to clearly form their words. Giving that pause without jumping in or finishing their sentences can make communication feel less stressful. Second, face the person when talking. Seeing facial expressions and mouth movements makes it easier for them to understand you, and it helps you pick up on more subtle changes in their voice or expression. It also may help give them cues when they're not over exaggerating their facial movements as well. Third, reduce background noise when possible. Turning off the TV, lowering the radio, or moving to a quieter room can help your loved one preserve energy and speak more clearly. And finally, celebrate small wins, whether it's a louder voice, a clearer word, or a meal without coughing. Those moments matter. Parkinson's is a gradual condition, but progress still happens, and your encouragement can make a meaningful difference. These small adjustments create a more supportive environment and help your loved one feel heard, understood, and empowered.
I know my body's changing, but knowing there are tools that can help, that makes a difference.
And that's exactly why SLPs are part of the Parkinson's care team. We support communication, swallowing, cognition, and overall quality of life. To any caregivers listening, you are not alone. Parkinson's disease is complex, but understanding the why behind the symptoms can make daily life feel more manageable. And remember, small changes can make a big difference. Thank you for joining me on this episode of Gray Matters. If you found this helpful, feel free to tune in next time as we explore more neurological conditions and how speech therapy supports people across the lifespan. I'm Graycee West. Thanks for listening.